Hello, I'm Dr. Michelle Boudreau, and I'm a neurologist. So I'm here speaking with you today for Stroke Awareness Month. I'll be talking about lifestyle changes that can be made prior to a stroke to prevent a stroke, as well as after a stroke occurs to help facilitate recovery from the stroke. So, as a family member of a stroke survivor, my father did have a stroke in 2019, and so I have some personal experience related to this. I can attest that prior to his stroke, he was relatively healthy but did have some underlying health conditions. And that's one important thing to keep in mind to prevent a stroke would be to understand what health conditions can cause a stroke and to try to prevent those health conditions from getting out of control. For instance, if you have diabetes or high blood pressure or high cholesterol, it's important to try to keep the sugar levels, the cholesterol levels, and the blood pressure under reasonable control. Because if you don't, that can predispose you to having a stroke. So, staying away from sugary foods, carbohydrates. If you have the diabetes, people who have high cholesterol should stay away from fatty foods or high cholesterol foods. Mediterranean diet is often helpful as well to keep these conditions under control. And then high blood pressure, if you have a history of high blood pressure, we recommend trying to keep that under control with exercise, as well as diet, decreasing salt intake. Smoking as well can predispose you to having a stroke. So that is one major lifestyle change I often recommend, not only before a person has a stroke to prevent the stroke, but also after a person has a stroke. If they're still smoking, I recommend that they discontinue, because not only can that hinder recovery from a stroke, but it can also cause another stroke in the future. After a stroke, it's important to understand that some people do not have 100% recovery, but in order to gain as much recovery as possible, there are things that you can do. Oftentimes, rehab will be recommended, and the effort you put into rehab is extremely important. So, what rehab allows you to do is to adapt to the changes that occurred in your brain, and sometimes you can make other connections in the brain to compensate for the loss of function that you had from the stroke. The other important thing to do, not only before a stroke to prevent a stroke from happening, but after a stroke as well, is to make sure you follow up regularly with your physician and all the providers that are helping managing your care. Another important factor is to think about stress levels, because that can hinder recovery after a stroke, especially. Another important factor to keep in mind is trying to stay physically active and exercising. Once again, this is important not only before a stroke to prevent a stroke from occurring, but is also important after a stroke. Exercise before a stroke can help lower blood pressure in the long run, as well as it can help keep weight down, which will in turn help decrease your risk of developing other conditions like diabetes, high blood pressure, high cholesterol, which, as we discussed, can cause strokes. And then after a stroke, trying to stay as physically active as you can is important, because that will help you recover quicker and help you recover closer to your baseline. And it, once again, will help prevent another stroke from occurring in the future. The most important thing that I cannot emphasize enough is, if anybody, either if it's you, a family member, a friend, anyone around you, or yourself, start having stroke-like symptoms, it's important to call 911 immediately and get help immediately. Using the BFAST screening tool is important. That will help you identify certain symptoms that potentially could be stroke. And getting that help immediately and not waiting is extremely important because we have very time sensitive treatments. And the sooner we give those treatments, the better the outcomes tend to be with people who are having a stroke. So, extremely important. One other point I wanted to touch upon is when you're discharged from the hospital after a stroke, there's going to be recommendations that you take certain medications. It's extremely important to continue taking those medications as prescribed. The risk of another stroke occurring will be lower. And so that's why it's extremely important to take those medications as directed.